Good morning. I'm ANANTHA Shekhar. I'm one of the co-chairs of this workshop, and I want to welcome you all to the second part of our workshop. This has been a three-part workshop that we have been planning, and we had our first meeting last Monday, and this is the second part of that series. Today, we are still working on the innovation and drug R&D for prevalent chronic diseases. And while the first session covered a lot of the preclinical and the basic discovery part of the R&D, today we'll be focusing on the clinical development and many of the clinical aspects of innovation and drug R&D for prevalent chronic diseases. All parts of this workshop are convened by a standing body at the National Academies of Science, Engineering, and Medicine. It's just the Forum on Drug Discovery, Development, and Translation. The forum offers an ongoing neutral venue for stakeholders from across the government, academia, industry, foundations, and consumer and patient groups to discuss and confront issues of mutual interest and concern. Through the workshops and other activities, the forum brings together thought leaders and to focus on public issues and critical areas and foster collaboration and activities to understand and address them. In accordance with the National Academy's procedures, an independent planning committee organized the workshop. Periodically, you will see on the slides that will flash by the names and the members of this planning committee, as well as their bios are available on the website and the program booklet. I'd like to thank the forum for their leadership and support, and especially the planning committee for their vision and efforts in putting this workshop together. Without the hours of contribution from them, we couldn't have come up with such a wonderful set of presentations. A couple of important notices about the National Academy's workshop. While this is a standalone workshop and is not part of an ongoing consensus study by the National Academies, it is a starting off point for future activities related to innovation for prevalent chronic diseases. A summary of the presentation and discussions made during this workshop will be prepared by a reporter and will reflect what transpired at this workshop. It will be prepared in accordance with the institutional policies of the National Academies and made broadly available to the public. All views presented in this summary will be those of the workshop participants and attendees, and it will not contain any findings or recommendations by the planning committee. The summary will be made broadly available to all the scientific communities. Couple of housekeeping notes about the webcast and the social media engagement of these workshops. For those of you participating in Zoom meetings, please remember to keep your cameras off and your microphones muted unless the moderator calls upon you. If you have a comment or a question, please add them in the comment box or the chat box of the Zoom. For the webcast attendees, you also have the option to enter your comments and questions in the Q&A box of the website, and it should be under the webcast video window. If you are in a full screen mode, that Q&A box may not appear, so you'll have to get out of the full screen mode to see that. There are also hashtags for this workshop. Those are hashtag chronic diseases and hashtag drug forum. So if you, these are also listed along the workshop rotating slides. We highly encourage viewers to share their insights and observations about the workshop on social media using the hashtags. However, you should note that if you put a question or submit a comment to the hashtag, it will not be part of the workshop notes. To become part of that, you need to put it in the Q&A box of the website or through Zoom. So, Carl?
Great, thank you, Anantha. Hi, good morning. This is Carl Garner. I'm co-chair and assisting Anantha to chair this workshop over the 3 sessions that we are having. As Anantha mentioned, our first session was last week. And then next week, we'll have our 3rd session, and I'll cover a little bit about the content of that in a moment. Let me make a few additional housekeeping comments today. We'll have a break at about 12:25 Eastern Time following our panel discussion from the morning session. The workshop is being transcribed to aid in the writing of the summary. The transcription will not be made publicly available after the workshop, but the staff from the National Academies will use it to aid in writing the workshop proceedings. Also, for the audience members asking questions or providing comments, you can enter your comments and thoughts directly into the Q&A box under the webcast video window. And I want to remind you that there may be a slight lag given the virtual format. So if you ask a question that doesn't come through right away, we will get it eventually, in time permitting. We'll try to address all that we can today. The video recordings and slides from today's workshop will be posted on the workshop within 1 week of the workshop. And throughout the day, the speakers will be introduced by affiliation and title before each session, and their detailed bios for them, as well as the members of the planning committee, can all be found in the briefing document that you can find online for this workshop. For the purposes of this workshop, unless specifically stated otherwise, it's assumed that all comments made are the personal views of the participants and not statements made on behalf of their organization. Also, the National Academies are committed to the principles of diversity, integrity, civility, and respect in all of our activities. We look to you to be a partner in this commitment by helping us maintain a professional and cordial environment. All forms of discrimination, harassment, and bullying are prohibited in any National Academies activities. Moving on to more specifics around the workshop this morning, I think I'd like to kind of start by reframing some of the content and discussion that I mentioned last week, if you were part of that session last week. If not, this will be a bit new to you. As we looked at developing the workshop and trying to get insights from the scientific, medical, academic, and in fact, the whole healthcare system on how to incentivize innovation in drug research and development for these chronic diseases, it didn't take us long to realize, maybe we all realize this already, that half of Americans live with at least one chronic disease, such as heart disease, cancer, or stroke, or diabetes. These are all chronic diseases that are leading causes of death and disability in the United States and are a leading driver of our healthcare cost. Yet investments in these diseases, other than cancer, have not really kept pace with the public health need in the U.S. Recent published data from Bio has shown that venture investment for drug development in areas of psychiatric disorders, cardiovascular disease, diabetes, and respiratory diseases have declined over the past decade relative to the prevalence and the healthcare cost growth in these same diseases. And then, of course, in the past year, we've seen the COVID virus, the coronavirus 19, further exacerbating the health disparities associated with these highly prevalent chronic diseases. In a case study from hospitalized COVID-19 patients in New York City early on in the disease, as well as many other publications since then, have shown that the most common comorbidities and risk factors, by the way, are things like hypertension, obesity, and diabetes, all of which are part of the chronic diseases that we're talking about in this workshop. So clearly there is a burning platform and public health need to advance not only discovery that we discussed last week in new targets and new drugs that could potentially treat these diseases, but the clinical development and the registration of these new entities. I didn't really introduce my background, but if you look me up in the background, you'll see that I actually work for a pharmaceutical company, Eli Lilly and Company. And even within our company, I've seen a decrease in our investment in some of these diseases for which we'd actually created quite a legacy in things like depression and schizophrenia over the past 30 years, for which now we are not investing as much as we had been in the past. So these are all part of the burning platform that led to our discussion today. So in the first session, which will take us through to about lunchtime, we really want to cover the unique cross-cutting challenges facing clinical research for these prevalent diseases. And we want to highlight opportunities to overcome those challenges and things that we can do to mobilize R&D, the R&D innovation engine. So our first speaker today is Kristen Beasley. She'll be talking about a patient's journey. And of course, just as we did last week, and we're doing this week, we want to start first with the patient, because it really doesn't matter too much about what we're trying to do in the R&D engine if we don't always keep our focus on the true north, and that is our patients.